Good morning. It's time for another segment of Helpful Health. And this time we have a special guest from Renown to talk with us about that gene that Angelina Jolie had tested. Good morning and welcome, Brandy.
Thank you for having me.
Okay, so Angelina had this gene tested, and I actually was trying to look into it, the BRCA1 gene, and hers was faulty. What exactly is the BRCA1 gene, and what does she mean by faulty?
There's actually two of them, and sometimes we also call them BRCAs. To make it a little easier, you can say BRCA1 and BRCA2.
I like that much better.
Yeah, especially if you say it 100 times a day.
Mm-hmm.
The genes, we all have them, and they're actually genes that are there to protect us from developing certain types of cancer. When she's saying that it's faulty, well, what that means is that she's inherited a mistake in one of those genes, and that's putting her at a higher risk for certain cancers.
How common are these faulty genes?
They're actually not very common in the general population. Less than a 1% chance. It's really not that common.
So then who exactly should get tested for this gene?
Well, we do know that about 5 to 10% of breast and ovarian cancers are caused by a faulty BRCA gene. So if you have a certain personal or family history that might suggest that that's going on, that's when you might want to talk to your doctor about testing. And they should refer you to a genetic counselor like myself, where we would take a more intense look at your family history and let you know if we think testing would be helpful in your situation.
Why would somebody want to know this information? Like, how can it help them, and what options will they have?
Well, most people at first may feel like they won't want to know what their risk of cancer is. But if you can better understand what your overall chances are, you may be reassured. Some people overestimate their lifetime risk, or you may be able to talk to your doctor about more personalized screening. Some people do choose more aggressive and preventative measures like Angelina is. You and your doctors would make the best plan. It may be those surgeries, it may be medications that can lower your risk, or it might just be earlier, more frequent, and more intensive screening.
And what does this kind of testing cost?
Most people would need the full test, which is about $4,000. Other people may need a lesser intense test that's about $500.
Now, if you need more information, where can we go for that?
Locally, you can go to our website, renocancergenetics.com, or if you just want more information about BRCA and breast and ovarian cancer, go to facingourrisk.org.
Facingourrisk.org?
Yes.
Well, thank you, Brandy. That was informative, and now we know more, and we'll share this for you on our Facebook as well. So thank you so much for coming in today.
Thank you.
And there's more on the way. Hang on.